Good day, everybody. My name is Dr. Garfield Clunie. I'm a doctor in New York City, a high-risk specialist.
All right, so we're down here in Kingsvale for JAHJAH Foundation Healthcare at a church and spill over into the health center down here,
Right.
clinic.
Yes.
How are things going so far?
Things are going great. What I really love about it is it's really a testament that people actually care about their health. But, as always, across the world, there's a lot of issues with access. But the women are here, they're telling their history, they're asking questions, and this is really great.
All right, so Dr. Tony, you're a very accomplished doctor and more renowned doctor, son of and a product of Jamaica.
Yes, sir.
And you have returned home to be of service to your fellow Jamaicans.
Yes, sir.
Tell us about it. What does it mean to you?
Yeah, everybody has to do their little part in the world. There was a little saying by Desmond Tutu like that. And Jamaica has given so much to me. Although I left here when I was 4, I've gotten so much support from family and friends over the years. And it's an absolute pleasure to come back and support the country in any way I can.
All right, and lastly, what would you want people to know about the work that the JAHJAH Foundation has been doing down in Jamaica, which is what you witnessed with the 2 hours?
Wow, how do I start? It's hard to capture that in a few words. I mean, the JAHJAH Foundation, I've been affiliated only for a few years now, but this is an amazing organization that not only thinks about healthcare, but thinks about food insecurities, bringing food, bringing toiletries, even supplies to help, house repairs. I mean, JAHJAH Foundation does it all, and I think it's because all of us have some connection to Jamaica, and some of us that don't love Jamaica, and we just love giving back, and we love the way the people appreciate us for coming down. So it's a great organization.
Thank you very much for taking the time to speak with me and to give back to your beautiful country and your people.
Yes,
you want to keep you. I know you have a room full of patients.
Yeah, thank you. All right, man. Good.